My name is Orlando Vidal. We are here at the National Association of Specialty Pharmacy 2024 show in Nashville, Tennessee. I represent Cold Chain Technologies, and at this show we had the opportunity to run into Dave Swenson, an industry expert in hospital pharmacy and well-renowned throughout the industry for building companies and assisting pharmacies in their operational issues. So we had the opportunity to grab him, ask him a couple of simple questions. So Dave, welcome to NASP, and thank you for stopping by our booth.
Oh, good morning, Orlando. Nice to be with you.
All right. So yesterday we had a lot of people come to our booth, and there's some questions, and we formulated some of the most popular questions that they had to ask us. So I wanted to share those with you. So thank you for coming by this early in the morning and helping us out. So let's dive right into it.
Sure.
So one of the questions that we are is, what are some of the largest operational challenges that specialty pharmacies deal with today?
Well, it's been interesting hearing from folks at the show and some folks I talked to before I got here. One of the big issues that we're hearing about a lot is labor. You know, as these specialty pharmacies grow, they need more people. And it's not just anybody. They need to find people with a high acumen for technical work that can work in these areas. And they need to be able to be trained well and quickly. So labor is really the number one challenge they're facing. Another really big challenge that comes really with this is just being able to scale. When these pharmacies get started, oftentimes they're small. There's just a few people, a few prescriptions, and it can build slowly, and it ends up sneaking up on some of the pharmacists. And they'll find themselves in a place where they can no longer handle it on a very manual basis and need to then work to figure out how to make this scale.
So in your opinion, as a result of going through COVID and people working at home, is it more difficult to hire pharmacy technicians as a result of people wanting to work from home? Because during COVID, specialty pharmacies and maybe front-end people were able to work from home. So is that creating an issue for on-site and specialty pharmacy?
Certainly it's one of the issues, yes. The fact that this is a hands-on technical job where the people have to be in the pharmacy through their entire week. So yes, that is a challenge because it is really a new expectation that people hope to be able to work from home part of the time. So it's a money saver. Obviously, it's something they want. But having a job where you have to be there creates a challenge. Another really big challenge is the fact that in many states now, pharmacy technicians require some certification. So in addition to finding the people, they have to go through a certifications course. So then they can then qualify to work in that environment.
So do you think that as a result of labor issues that maybe across the country, state boards of pharmacies will start considering the reduction of the ratio requirements? Like when I started working in pharmacy in some states, it was a 2-to-1 ratio, one pharmacist, 2 technicians.
You know, that's a hot question in many boards of pharmacy, that ratio of how many pharmacists to technicians. And unfortunately, in some boards of pharmacy, this used to be the case more than it is now, but there's a lot of protection around that ratio in the sense of making sure that they have the pharmacists on site and the supervision of technicians doesn't spread too far. So it is a sensitive issue with many boards of pharmacy.
Got it. So with technology development, I know when I worked in pharmacy, there was a lot of technology development in PV process. We had over 400 technicians working in our pharmacy.
Right.
And we wanted to get the pharmacists back into what they were doing as opposed to what we used to call lick and stick. And technology, it really helped that out a lot. And it looks like technology today is going to maybe help in that ratio issue sometimes.
Well, and in fact, for many startups, many of the technology companies, pharmacy automation technology companies, they see it as a big opportunity because by having automation, you can keep that ratio the same and really have some of this new technology do a lot of the repetitive manual work, which really helps a lot. So in the future, you're gonna see more technology in this area. You know, hospital pharmacy per se has had technology growth for years and years now. It started back in the 90s with companies like Pyxis and Omnicell, but now you're seeing these same companies extend out into these new environments like specialty pharmacy. We're here at a specialty pharmacy show not surprising to see companies like Omnicell here talking to people, seeing how they can provide technology that will help.
That's great, because my belief is that the technology, not only that, will help with dispensing accuracy,
Right.
record
Yes.
keeping, statistics, logistics,
Accuracy,
everything that they
safety.
need in
Yeah.
the overall cost of operating a specialty pharmacy. The second area of concern was for pharmacy leadership, specialty pharmacy leadership. What kind of guidance, with your experiences, could you provide?
Really great question, and it's one that's on the minds of. I've seen a lot of people stopping by and talking here. How to gain the skill sets necessary to work in a large specialty pharmacy operation. We talked a minute ago about scaling and how important it is to be able to successfully scale a specialty pharmacy. Well, this really depends on skill sets. These managers need to know how to set up the processes and procedures so they can train people rapidly when they come in, so they can assure the quality necessary to qualify and get certification through companies like NERAC. Really important to do. Also, as they scale, the policies and procedures need to be done in such a way that scaling can be very successful. A lot of these places have grown to a point where they didn't think they would. They're grown to a very, very large scale operation.
So it's interesting you mentioned URAC, and there's also ACHC, and one of the things that we pick up on is in the industry, specialty pharmacy management, leadership, there is transition. Maybe perhaps, it's evident for us that people that we started doing business with as they pick pharmacists in charge move on, and we found that through cold chain technologies, providing them with what we call a compliance notebook specific to the cold chain technologies and how to package and temperature selection, all the above. It abates that tribal knowledge of, hey, the director moved on, how do we continue? So, in building a process of stable SOPs, SOWs, we provide all those services for them and hope that, hey, electronically with technology, they can keep a compliance notebook and move forward. So when people get promoted, technicians leave, there's rotations, all that foundational information stays with the pharmacy.
Well, it's a great point, Orlando. And one of the things I've seen just being with you guys and watching you work here at this show is that you're in such a unique position. You've been in so many pharmacies and seen so many operations that you have this broad experience that you can draw from to help all of these folks who are just coming up through the process, through the learning curve of understanding how to operate specialty pharmacies. You guys are a great resource for that reason. Because who else really, think about it, who else has been in literally dozens and maybe even hundreds of pharmacies around the country and seen these operations work? So kudos to you guys for being out there and doing this.
Well, we try to be innovative and provide services that go beyond what we say, beyond the pack out. For us, the cold chain packaging is part of the script because, again, we recognize the value of what's going into that box, and no box, no script, no patient, no therapy. So we understand that. So we do everything we can. One of the questions was, which I would be really happy to answer, but I'd like to get your feedback. What other pharmacy leaders, what kind of cold chain resources do they have available to them?
Well, it's interesting to see there are some consulting companies here at this show, and I know, have hired pharmacists who've been through this experience of building a specialty pharmacy. So they're out there and they can help in many of the areas, kind of beyond the cold chain or to the packaging components, to help with things like patient compliance or patient adherence to medication therapy, helping to assure outcomes with the patients. In fact, it's been interesting walking around and going through at this show and looking at some of the academic posters that are here, and you're seeing the growth in their ability to provide this medication adherence structure so the patients can successfully administer these medications in a home environment and other places like that.
All right. So I think we touched on it a little bit, but let me follow through with the question. So, in your opinion, how much labor is spent on specialty thermal shipping, analysis, assembly, packing, shipping? how much labor do you think is actually spent in the overall operation of the pharmacy?
Well, it's an interesting question, and I'd relate it back to a learning curve. Because when you begin this process, it seems like something that is sort of informal that you can do. It's like, putting a package together to ship to your parents at Christmas time. It kind of starts there in terms of how they'll put this together. Very manual process that they'll assemble this, but then it starts to scale. It starts to grow. And what seemed like an adequate approach at the beginning, as they start to climb that learning curve and scale, it's just discovered to be not very efficient. So they have to really then work to standardize, to develop procedures around this. And as they do that, then they can develop this efficiency. And that's where you guys can come in and help so much, because you've seen it and you've seen people work through that learning curve and get to the point where it's a high production, high capacity process that becomes very efficient.
So one of the things that was developed in the mid 2000s, early 2000s was, there was a Six Sigma process that was utilized throughout for process improvement, and automated pharmacies became prevalent. But then we could never really get a specialty pharmacy or robotic systems to select a gel pack, pack it in a box, because of dexterity, and we needed dexterity to pick and pack medications. So the success of automated processes is the elimination of variability in your process.
Absolutely.
Right? So in specialty, turnover of technicians packing out medications adds a lot of variability into the process. So how, in your opinion, how does that impact the overall process of right med, right patient, right temperature, right box?
Well, first of all, I'll say, just as a pharmacist by background, the technician role for years had been kind of a stepping stone to something else for many people, rather than a career. And so it became kind of a natural process to see these technicians come in, get very proficient, and then leave when they go on to something else. So that has been one of the key reasons why it's been necessary to develop a structured approach to training the technicians as they come through, and developing this into a career by providing an adequate environment that makes people satisfied that they can rise through a career. So with that, it's really necessary to have that structure in place. Now, the other thing about this that I think we'll see with time is there is a role for automation here, but it's different than the role of automation has in a hospital pharmacy, because automation works really well when you're doing the same thing repetitively over and over. That happens more in a hospital pharmacy with syringe preparation, other things they're doing here. Specialty pharmacy provides a process where there's much more variability between the package sizes, what's being put together. So it's a bigger challenge for automation to come through and do that. Now, that being said, some of the automation companies are starting to crack the code on how to do that.
Let's see. So it's early here in Nashville, and I just want to simulate what happens. I'm not a pharmacist, but this is what I see that happens in the morning. We're here, pharmacies aren't open yet, but this is probably what a lot of people are familiar with. Start my day, have my coffee, looking at my reports, I key in Google Maps. What's the weather look like across the country today? How are we going to pack out today? We're going to ship to Miami from Nashville. What temperature is it? Do we use a hot pack out, cold pack out, moderate pack out? I don't know. We got to guess. We got to figure it out. So you're spending probably about an hour or two before you even do your first script and determining what temperature range to go. So if that's you and you're having those questions, then reach out to us at Cold Chain Technologies. We want to tell you about our Route Pro, which tells you which pack out, which temperature, what pack out to use, hot, cold, or moderate for your destination. Thanks a lot. Orlando Vidal for Dave Swenson. We're at the National Association of Specialty Pharmacy Show, Nashville, Tennessee, booth 400, 2024. Thank you.